Good morning, everyone. Sorry to bring up the conversation. As I've said many times, I think that's the most important part of the breakfasts we have is getting to talk to everyone at your table about things that are happening in the community and solving problems. So I hope every single table has solved at least one or two problems. How many? I heard how many? Yeah, okay. We won't go there. First of all, Tony Brown is out sick today, so you have me talking in his place. So sorry for that. First of all, happy holidays, Merry Christmas to everyone. I think this is, after Thanksgiving for me, then it's the Christmas season, holiday season. I'm sure we'll all have a great time during that, and just a very little snow too. I want to thank the elected officials that are attending. We have from the office of Senator Ron Johnson, Ginger Colesberger. From the office of Senator Tammy Baldwin, Rebecca Beretta. Good timing. We have Waukesha County Supervisors Mike Crawley. Am I missing? And we have returning or prior Waukesha County Supervisor Paul Decker here too. So. City Council members Mike Razine, Alicia Halvin-Slavin, Elizabeth Molson. We have City Attorney Brian Running. I want to thank, I'm kind of moving quickly because I've been given a much longer thing to talk about, which would have been Tony's job. So I want to thank Tuscan Hall for always providing us with a wonderful meal and a great welcome. Thank you, Tuscan Hall. The centerpieces are from Helping Hands Senior Group, and that's with the Parks, Recreation, and Forestry Department. The food pantry, I want to thank everyone who brought something for the food pantry or provided a donation. The barrel is full, and there's stuff outside of it, which is always great. Food pantry is in need of food. Their year-over-year increase in need is number of people going there is 23% more than last year. So please keep that in mind. Also, I know a lot of people provided donations as they walked in. All the donations that are received today are doubled because there's a match. So if you're on your walking out and you want to provide a donation, there is a little thing to put the money in. Where's Rebecca? Hopefully it's still there. Is it still there?
Yes.
Okay, it's still there. So, with that, I'll now become Tony, and go through his notes. I want to thank you for coming. A few quick updates on some upcoming city events and projects. First of all, thank you to everyone that participated, that made the Parade Memorial dedication, Parade Memorial as well as the dedication possible at Grady Park. That was truly a wonderful evening. The families that lost someone, the families that had people that were horribly injured, and the rest of the community, I think, truly appreciated the dedication of the Parade Memorial. It's beautiful, and I'm hearing that people are there pretty much all the time. So it is serving its purpose, and it will forever. As a community, I think that is just so wonderful that we're able to do that. At our last breakfast, we, meaning Tony, discussed some of the areas of focus from the city's strategic plan. So we did do a strategic plan. A lot of work went into that, and now we're trying to implement it. There's a number of committees or city officials that are tracking the progress and meeting the objectives outlined in the areas of financial stability, sustainability, service and excellence, people-centered development, and engaged community. We do plan on providing quarterly reports in 2025, and you can see that on our website. I know also a lot of you probably even were asked to fill out surveys for the strategic plan. If you are interested and you're one of those geeks that like that type of stuff, go onto our website and take a look at our strategic plan. Even if you're not a geek, it's still a good thing to take a look at. So the Common Council passed the city budget in early November. There's a lot of hard work that goes into that, and by the members of the Common Council, the Finance Committee, but also the staff too. That is our basically what we're going to be doing in the coming year is our budget, and I'm going to throw in my 2 cents here. I don't know if Tony would, but every community, every county in Wisconsin is facing a real problem in finances, and I'm not really sure how we're going to get out of it. The revenue is pretty much capped, and the expenditures are increasing. I'm just going to say you're going to see this continue for pretty much all the communities in the state of Wisconsin are going to be having problems, and it's just going to get worse in the future. So with that, happy holidays. Yesterday, the water utility launched a new website, take a look at that. If you want to do auto pay, I really recommend that. You can have paperless billing and auto pay. It works well for us, for the water utility, and it also works well for you. I've been on auto pay for quite a while and enjoy it. I haven't missed paying a bill for about a year and a half. So. In March of 2025, we're transitioning to new garbage recycling hauler, John's Disposal. If you live in the city, there'll be mailings and social media and every single way we're going to try to get a hold of you because there'll be choices for cart sizes and you will need to pick if it's a residence. In March, you'll start seeing John's trucks instead of what is it now? Waste Management. Thank you. There's a number of upcoming holiday events. They're not on the screen anymore, which is good. This Friday, we light up downtown Waukesha on the riverfront with the Night of Lights starting at 5:30. So it starts at the Rotunda, then there's some caroling through the streets of Waukesha, and then we end up at the river where we turn on the lights for the Night of Lights, which if you want to do Christmas photos with your family, go down to the Night of Lights after Friday. It is a beautiful place to take your family photos. On Saturday, we have the holiday movie showing at the Polar Express at the Schutze Recreation Center that starts at 6 p.m. So if you have, I don't know, kids under 10, maybe you can go to that. You can go to it if you like it yourself, I guess. December 8th, Sunday, is the annual Waukesha Christmas Parade. Starts at 4 p.m. I'm looking forward to that, and I know the weather will be perfect, 33 degrees and no wind and no snow for sure. And we're looking ahead for the 40th anniversary of the Waukesha Jamboree. 40 years of the Jamboree, that's quite a tenure. It's a great time, so many different events. We get a lot of participation from the community, the county. So many entities make that something that gets people out in late January and instead of sitting on their couch where it's warm. Now I have the privilege of introducing our speaker. Remember, I'm Tony. Fire Chief Rob Goblin. Chief Goblin has been with the City of Waukesha Fire Department for almost 4 months. He just attended his first Packer game, not as a firefighter, like 2 weeks ago, which was kind of amazing since he's attended games for 17 years. First time he was there as one of the problem, not one of the solutions. Prior to joining the City of Waukesha, he spent 27 years of service with the Green Bay Metro and the City of Green Bay Fire Department. So welcoming Chief Goblin.
Good morning. Thank you all for being here to hear a little about Waukesha Fire Department, and I thank the mayor as well for giving me the opportunity to speak with you this morning.
Opportunity, it was basically you're doing it.
Voluntold, we refer to it, right? So I was asked to give a little bit of background on myself and then talk a little bit about Waukesha Fire and what it is that we do as Waukesha Fire. I'll also discuss some of the things and the equipment that we use, but also one of our primary initiatives that we're working on in the department, I think is very important to our community. So to start us off, I'll talk a little bit about me and my family. So that first picture up there that you see is me and my wife, Nicole. So we both are from western Wisconsin. We grew up around the Eau Claire area, so just south of Eau Claire, just north of La Crosse. And I met her in high school. We are high school sweethearts, and we've been married about 27 years, over 27 years, not about. We have 3 children. You can see them there in the picture. Grant is my 22-year-old son. He is in school right now over in Green Bay to go into the firefighting field. So I'm happy about that. I'm also happy to note that his brother lives with him. He is also going to school for marketing in Green Bay. And my daughter on the end there is, she is in UW La Crosse going to school for finance. So the 2 on the ends of that picture are twins, 19-year-old twins. This is why I have no hair. Now, when my wife gives this presentation, she often talks about the fact that she has 4 children. I've never seen this 4th child, but she tells me he's 6 feet tall and bald with a mustache. So I'm assuming she's talking about me. So I have 32 years of service in the fire service. I started in the small town that I grew up in, and it really is small. The population of that town was 338 people. My graduating class was 38 people. And the picture of the road that you see there is the road in my hometown. So, I started there as a volunteer in the fire service, as many people who get into the fire service do. One of the first places you get experience is by volunteering with a local department, and starting off with that commitment to your community early on in your time in the fire service. I then left there and went down to Madison and attended Madison Area Technical College, where I got my associate's degree in firefighting. Eventually, through UW Oshkosh, got my bachelor's degree, and then through the Naval Postgraduate School, got my master's degree in Homeland Security and Defense. So continuing throughout my career to learn and grow, which is something that I absolutely encourage all of our people in the department to strive for and continue to do throughout their life. Eventually getting hired in Green Bay and starting my career service. Backing up 1 second, in Madison I was on the Fitchburg Fire Department, which is a paid on-call fire department just outside of Madison. Then in 1997 I was fortunate enough to get hired in Green Bay and started my career as a career firefighter. I spent 27 years there, as the mayor mentioned, and eventually when I left there, I was the assistant chief of operations. So what operations means is everything that you see going on out in the street, that's what we consider operations. When a crew is responding to a call, when you see the trucks driving down the street, when you see them out training or working on the facility or any of those kinds of things, that's operations, right? I was responsible for, a lot of people ask, you know, kind of size comparison, how does Green Bay compare to where you are now? Green Bay, the population of the city itself is about 107,000. We also serve 2 other municipalities that total about 140,000 people. We went on just about 19,000 responses a year. I was responsible for overseeing that operation. I did our budget, which was around $30 million. I handled all of our personnel issues, which we had 212 sworn personnel on the department. So I had a lot of opportunity to learn a lot of great things while I was there, and I also had the opportunity to work at Lambeau Field every game for 17 years. And it sounds really cool until you're 12. Really? Especially when it was on Thanksgiving or Christmas or whatever. It was an excellent experience. And one of the things that we kind of used to relate what that was like, the size of Lambeau Field, when you fill it up with all of the employees and all of the fans, Lambeau Field itself becomes what is the equivalent of the 5th largest city in the state of Wisconsin inside the 3rd largest city. And you have to manage all that at the same time, which is really, really cool sometimes, really strange sometimes, and occasionally mildly terrifying. But very interesting experiences working there. But then I saw a great opportunity come up, and it was the opportunity to come here and work in Waukesha. And when I got into the fire service, one of the places you heard about right away was Waukesha and Waukesha Fire, and the reputation and the professionalism demonstrated by the Waukesha firefighters. So when I saw the opportunity, I knew I had to go for it. And I'm incredibly fortunate and honored to be selected to be a fire. So I started here with Waukesha on August 5th, 2024, and I'm happy to be here and enjoying every second. So what is it that the fire department does? We name ourselves very poorly. We are the fire department, but we do a lot more than that. And I will get into what it is that the fire department does a little bit more. But the most important thing we do is making sure that we are able to provide efficient and effective emergency response services throughout the community to everyone equally and fairly. Not only with fire response, but with emergency medical response, which is the type of response that keeps us the busiest. And we'll talk a little bit more about that later. Obviously, the way that we do that is we need to understand what is going on in our community and what are the risks that we are facing here in Waukesha. What specifically do we need to be able to manage and respond to in order to help out our community the most? So we perform a risk assessment and make sure that we understand what's going on here, what it is that we need to be able to handle, and then we tailor our response and our organization to them. Fire departments all over the place, and fire burns the same here, and a heart attack is treated the same there, but what it means to the community and how we go about providing it is specific and unique to each community based on the risks associated with it. The way that we do that is with our most valuable resource. It's with our people, our personnel. So we spend a lot of time seeking out and finding people who value and are committed to honesty and integrity as part of what they do in their daily life. And if that is a commitment they have, we're more than happy to hire them and bring them on and train them to do what it is that we need them to do out in the street, to help people when they're having their absolute worst day, to come in and make that day better. So we spend a lot of time looking for the right people as well. So a little bit about Waukesha Fire. The fire department was founded in 1852. It started out as a volunteer fire company. Again, that's kind of the history of the fire service in the United States. Back then, there were 28 members on the department. In 1891, Albert Mavis was the first line-of-duty death in Waukesha Fire's history. He was responding to an incident on a horse-drawn hose wagon, and there was an accident where he was killed in the line of duty. Then in January 26th is the anniversary of, or the start date of Waukesha Fire as a career agency, where they made the decision to hire 16 career personnel. And then in 1934, unfortunately, the department suffered 2 more line-of-duty deaths in another accident where 2 firefighters were responding on an engine and unfortunately were struck by a train as they were responding to an incident. So a little bit of the history there that also outlines the risk and the danger and the commitment that firefighters and public safety professionals have for their community. Like all municipal employees, everyone's committed to their community, but some of the history there. Compared then to now, what does Waukesha Fire Department look like now? So our department currently has, we're 118 personnel, 104 of those are sworn, and then we include our intern program and our support staff in that number as well. Those personnel work at 5 stations throughout the city, and each of those stations Every station has either an engine or a ladder truck and an ambulance. So the engine or ladder truck we refer to as a heavy piece, just because it's big and it's heavy. But it's referred to as a heavy piece and an ambulance. So every day we have 5 personnel working at each station for 25 people plus our on-duty shift commander, battalion chief, who all of those personnel that you see in that second bullet point there are working 24 hours a day, 365 days a year. So they work a 24-hour shift and respond to all the emergencies throughout the city. As I said earlier, we name ourselves the fire department, but we do a lot more than just fire suppression. Obviously, that's our background and our history. We make those responses. We also handle all of the paramedic level, or as we call it, ALS, Advanced Life Support. We handle all of the ALS care within the city of Waukesha, including transport of patients to any local hospitals in and around Waukesha. We also handle all hazardous materials responses. So when you have a facility that uses hazardous materials and there's some type of incident there where there's a leak or a release of the chemical, we respond to that. It might be a traffic accident involving a chemical. It might be a train car that is leaking or having some kind of emergency involving a chemical. We also deal with all the specialized rescue. So in our line of work, we refer to it as USAR, U-S-A-R, Urban Search and Rescue. And that encompasses things like rope rescue, building collapse responses, trench rescues, all of those kinds of things. So when you see building projects and construction projects going on, occasionally there might be a trench involved. If there was an emergency involving that trench, we'll come in and help do that rescue, conduct that rescue. We also provide these services, hazmat services and USAR services, countywide. So it takes a fair amount of resources to do that. And so we've adopted a countywide program, and we do deliver some of those services here and there just outside the borders of the county. So part of a statewide network also that does provide those services around the state on a much bigger scale. When I talked before about how we make sure that we're meeting the needs of the community, I talked about that risk assessment piece and how we look at the community to see what we need to provide. And that is called, in our world, community risk reduction. So we look at the risks going on in the community and we put a plan together to make sure that we minimize those risks as much as we can. So we do that through our Fire Prevention Bureau, which is staffed with 3 personnel, our fire marshal, the inspector, and the code enforcement inspector. And we also have our mobile integrated health position. I'm going to talk more about the mobile integrated health position in a minute. But we use many strategies when we're trying to reduce the risk in our community. You've probably heard of many times in your life a fire prevention program, right? Where we talk about how to prevent fires. We learned a long time ago that it's best for the community if we can avoid fires altogether, if we can minimize the risk and eliminate the hazard of having a fire altogether. We also learned that we can apply that to everything else that we do, and we'll get to that in the mobile integrated health center. Part of our risk reduction strategy is fire inspections and pre-planning for incidents at a facility before they occur. So if you have a business in town and we will actually take a look at it, we'll look at the building, we'll look at what's there, how many people are there, and we will put a plan together of how we would respond in the event that an incident happens there. Whether that incident is a fire incident, an emergency medical incident, or maybe it's one of those hazmat calls or kind of one of those more unique responses that I talked about before. We also have a lot of community outreach efforts. That is a huge part of risk assessment. Going out into the community, working with local groups in the community, working with neighborhoods in the community to understand what it is that they need from us, what it is that they expect from us, and how we can best work with them and help them out. So that is our command structure. So everything that we do underneath the umbrella of the fire department is done through the structure that we've developed here. We are what we refer to as a paramilitary organization, so it's a very chain of command oriented organization. And you see the fire chief there at the top of that, but really above that is the community, and the people that we work for, and the mayor, and the city council, and the police and fire commission, and so on. Our office is managed by our office manager, Kathy, who's phenomenal. She is one of the greatest people I've ever met, and I've only known her for a little bit. We have a financial analyst and an administrative assistant as well. Our fire prevention bureau that you see there, staffed by our inspectors, working throughout the community every day to go out and do inspections of fire prevention inspections and so on. Our medical director, everything that we do with our ambulances out in the field is done under the supervision and under the license of an emergency room physician. So our paramedics are actually licensed to work under that physician's license. It's all overseen by a physician. It's all reviewed for quality assurance and quality improvement and so on. Those 3 yellow boxes that you see there with the battalion chiefs in them, those are the regular daily shifts that you probably would think about when you think about the fire department. Who's out there in the street delivering the service? Each of those shifts works 24 hours at a time with all of the personnel in the department. And then you can see our 2 division chief positions as well. One primarily involved in fire training and safety, and the other one involved in our emergency medical services program and health and safety. So some of the stuff that we use and that you see every day, when we talk about a fire engine, most people, that's what they think of when they hear the term fire truck. They think of an engine. An engine is a truck that has hose and water on it. It's got ground ladders too, but hose and water is its primary function. Its job is to get there quickly and attack the fire and put the fire out. That's what a fire engine is designed to do. Then we have our med unit, which most people would refer to as an ambulance. In our world, if it's a med, it means it is staffed with paramedics, right? Versus an ambulance may not be staffed with paramedics. Its job primarily is handling all medical emergencies throughout the city, but everybody on each vehicle is cross-trained to do both. Everybody does the medical side and everybody does the fire side as well. Then we have the ladder truck. Now, we in the fire service call that the truck, right? But when you hear fire truck, again, most people think of an engine. So the ladder down there in the corner, when we refer to it as a truck, we also refer to it as a quint, which means it has 5 things. It has ground ladders, it has water, it has hose, it has the ladder on the top, and it has a pump. That truck is kind of a jack of all trades. It can do a whole bunch of things, right? That ladder on the top is 100 feet tall, so imagine yourself 100 feet up in the air, dangling on the end of a little stick, right? It's a lot more than a little stick, but that's how it feels when you're dangling out there at 100 feet. The LifePack 35, that is one of the most technologically advanced pieces of equipment that we have on the fire department. You will often hear it referred to as a cardiac monitor, and sometimes you'll hear it referred to as a defibrillator. So that is the piece of equipment that we can, if you're having any kind of medical emergency that might be heart related, we will connect this to you, and it uses all kinds of technology and all kinds of really cool algorithms to actually tell us what's going on with your heart. To the point now, when I first got in here, these basically said, either shock him or don't shock him. Now what it tells you is whether or not you might be having a heart attack in the very near future. It also connects directly to the hospitals and allows physicians on the other side to look at exactly what's going on live in real time out in the field and communicate back to our paramedics to help make sure that we're providing the best care possible for you. Another key feature, when I started, when we were doing CPR on someone that didn't have a heartbeat, we would actually have to stop and let the cardiac monitor analyze what was going on with that patient. Well, stopping CPR is not good because it stops blood flow through your system. The algorithms and the technology inside this thing now make it so that it can ignore CPR. And it knows that that's those firefighters and paramedics doing CPR. We can ignore that. And it looks only at what the heart is doing right then and there, so we don't have to pause near as long for it to do its thing. The only time we have to pause now is to let it shock, which is a huge advancement forward. And those are about to be deployed department-wide. We just took delivery of them, we're completing training on them, and those will go out on all of those pieces of apparatus that you see. So we have multiple, as I said, multiple strategies on our community risk side of things. And some of our main programs, learning the sounds of fire safety, where we go out and teach people, when you have a detector going off, how many of you have ever heard your smoke detector going off? Okay. Do you know what that beep means? The battery's low, right? Well, it might if it goes off every once in a while, like every 30 seconds or every minute, it might mean the battery's low. If it's making a lot of noise and it's irritating you, that means you're supposed to go, right? That means you might have a problem. But what does that beep mean? Close the door before you doze. We have found through research nationwide and throughout the world that the most important thing you can do to survive a fire in your home when you go to bed at night is shut your bedroom door. And I can tell you countless incidents I've been on where on one side of that door is absolute destruction and on the other side of that door is a relatively pristine room that you could very easily survive in. So when you go to bed tonight, shut your door, please. Develop an escape plan in your home. If you've been at, fire drills in schools, fire drills at your workplace. Do you ever do a fire drill at home? You should. Make sure that you have a plan and you know how to get out. It sounds simple, but in an emergency, when your brain's going a million miles an hour, something that you've practiced comes back very quickly. If you haven't practiced it, you need to. Cooking, fire safety in the home, another one of our primary initiatives to educate people on. The largest number of fires we get are caused by cooking. Hands down, without question, right? So we talk to people about being mindful of what's going on while you're cooking. Another one of our really interesting scenarios or programs throughout the city is an app called Pulse Point. So you can actually take your phone and scan that QR code, and it will take you to the Pulse Point site, and you have to put an app on your phone. But if you are CPR trained, anytime our 911 dispatch center sends out someone in cardiac arrest, someone who needs CPR, if you are close by that area, it will notify you on your phone that there's an individual in your area that needs CPR. It will also tell you where the closest automatic external defibrillator, or AED, is, so that if you had the opportunity, you could grab that AED. The most definitive thing we can do, the best help we can provide, is defibrillating that person early. It will tell you where that is, and it will tell you where the person is, and it will allow you to go help if you need to, or if you can. It's an incredible, incredible app. So those are some of our main initiatives that we drive throughout the community every year. But the big one that I want to talk to you about today is one of our newer initiatives, and it's our Mobile Integrated Health Caseworker Program. So what Mobile Integrated Health is it's kind of that piece of, if you remember I talked about fire prevention and we learned about preventing fires is the best thing that we can do. Well, Mobile Integrated Health is kind of an adaptation of that whole philosophy. And it's part of our community risk reduction program, where we have learned that the absolute best thing that we can do is prevent emergency medical incidents, just like we try to prevent fires. And dealing with crisis with an individual or crisis within a family before it becomes a true emergency. So it's proactive community-based healthcare out in the organization or out in the community. It ultimately helps to improve the outcomes of patient care for an individual with experiencing certain issues. We're moving that role of being reactive. The tone goes off and we respond out to give help, to trying to be proactive, to be more engaged and involved with the people in the community to better understand their needs so that we can help get them the assistance they need before it becomes an emergency. Ultimately, we've learned that a lot of people who call 911, the best solution for them and the best assistance that we could provide them actually is not a response from a fire truck or an ambulance. And it's oftentimes not a response from a police car either. It is connecting them with the right service, the service that they need, the program that they need to support them and help them through whatever issue it is that they're dealing with at that point in time, rather than a trip to the emergency room. Okay? Oftentimes that is not what they need. Where we see this recurring phone 911 call a lot is people dealing with mental health issues, or substance abuse, or things like food insecurity, as we were talking about earlier today, right? And housing insecurity. Ultimately, they don't necessarily need a response from 911. They need help to find the service that they need. And this can not only save costs for the city, it can save costs for the healthcare programs or the healthcare systems themselves, but it ultimately leads to better outcomes for the patient. It improves the quality of life for the people in our community, and it makes their life better, and it makes them enjoy living here. So this program is relatively new. We just started this program. That is Megan, our case manager, up there in that picture, and that's one of the pieces of information that went out when we started the program. The key responsibilities when Megan arrives and when someone who does this kind of work arrives, they're trained to do psychosocial assessments in different environments to make sure that they understand what's going on. They can do crisis intervention in the immediate short term that helps them to provide that assistance that is needed right then and there for that individual. Ultimately, the goal is to connect them. A lot of the people who are making these 911 calls and asking for help, they know they need help, but they don't know how to get it. They don't know certain programs are out there. They don't know who to call for that program. That's what this position really focuses on, is connecting what that person needs with the right program, the right community resource to get out there and really, truly make a difference. We also use them in our education side of things to make sure that we are communicating everything that we need to out to the community to help understand that this position is there and can help, and on the back end, helping to make sure that our responders and our other healthcare partners, understand what it is that we're trying to do and how we go about doing it. Right? And it can really help to identify and address some of those more sensitive issues within our community. Ultimately, the focus again is on mental health crises, substance abuse, domestic violence issues, elderly issues in our aging population. Sometimes, they have, as their experience changes in their home, we have to go into their home and help navigate through, some of the risks that might be in their home that we can educate them on and help them mitigate so that they don't experience an emergency in their home. Ultimately, as we've implemented this program, we obviously have to find funding for it. And currently this position is grant funded. And that's one of our concerns, is when that grant funding runs out, then we have to find another source of funding for this position. And I truly believe that this position is one of the most impactful positions that we have, and the concept of it is one of the most impactful as well. Really, the implementation comes from creating and generating good partnerships with our partners in the healthcare industry, with social services and community services, to make sure that we can make those connections and get everyone the help they need when they need it. So those are some of the implementation pieces of it. And again, I just think it's an incredibly valuable program. It's a new initiative throughout the country, and I'm happy to say that Waukesha is kind of on the cutting edge of it in the beginning of implementing programs like this. And it's incredibly valuable, and you can truly see the impact in individuals' lives after they have worked with our case manager and our personnel through this process. Now, as a mildly shameless plug, I mentioned recruiting and that we are always looking for the best and the brightest within our community. So if any of you would like to be firefighters, or you know anyone that would like to be a firefighter, these are our requirements for an individual to join our team. Obviously, we mentioned our values, honesty and integrity. That's number one. We can train you on all the rest, right? So you can see the requirements there, including Wisconsin Certified Firefighter 1 and an EMT basic license, and passing our CPAT test. If you know someone who's interested, if you're interested yourself, reach out to that email, let us know, and we can help guide someone through the process if they have that stuff, or even if they don't have that stuff, how to get it. Right? We've got a great program here that we work with WCTC on, an intern program where we're bringing people in, starting in high school, and they're in a dual enrollment program at WCTC, and they come in and they work with us, and we get a great opportunity to meet them and get to know them, and hopefully hire them and have them out working in our community. So if you'd like, please send an email there. And I think we're okay. We're really close on questions. So are there any quick questions I can answer?
With your integrated healthcare person, how integrated are they with health insurance companies? Because there would be a big savings if people took better care of themselves. So they're starting to do that.
Yeah, so that's one of the main hurdles that we have is what does insurance cover and what doesn't insurance cover, and how do you work with those programs? That's part of what we can help people to understand. But one of the biggest issues and one of the biggest cost savings from the insurance standpoint is minimizing and reducing the unnecessary visits to the emergency room. That not only saves that individual a fair amount of money, it also saves the healthcare system a fair amount of money, and ultimately, that might be part of their struggle. If we can help reduce their costs altogether as an individual, that's beneficial as well. So it is tied in there. The insurance side of things can get a little complicated, but it is tied in, and it's also part of our education on how to help them take care of themselves as well.
Might be good enough where that could be part of the source of funding.
That is part of the discussion that we have with healthcare partners, is whether or not some of that savings can be available, and sometimes it is and sometimes it isn't. So, but thank you, I appreciate that. All right, I think we are right at the time.
So I'll just finish up. One, have a great holiday season. Shut your door before you doze. I'm going to use that with my kids every single night. Shut your door. The mobile integrated healthcare manager, I'm just going to call it the case manager from now on because I'll never remember mobile integrated healthcare manager. There's not even an acronym to really use that. But that is something, we know it's going to save money for the community. The problem is it doesn't bring in funds for the city. So I'm kind of going back to what Tony was talking about a little while ago. That we need to be able to try to make it work. This is something, our police department also has case managers. These things really, really work. They provide much better outcomes. The fire department with a case manager will provide better outcomes. How do we pay for it is what we are going to be facing. I got 3 alders over here who are going to have to make those decisions in the coming years. As the chief said, we're doing it now with a grant. It's going to be a tough decision how we continue to make that continue. Yeah, how we continue to make that continue. Great. And my final comment is, enjoy each other and your families and make good choices. So thank you, everyone.